Okay, so we are very fortunate to have our last DYAD seminar today. Just as a reminder before I get into the specifics, the DYAD seminar is an opportunity for faculty and students working with faculty to co-present their work, their joint work, as well as talk about the mentoring process and lessons learned from that. So today we are extremely fortunate to have our distinguished faculty member, Dr. Jessica Schwind, who is an assistant professor in epidemiology, biostatistics, and environmental health sciences. And I will let her say more about herself when the time comes. And she is going to co-present with Dr. Holly Richmond, who is finishing her MPH in our college as well. And Dr. Richmond is a practicing veterinary scientist. I'm sorry, that pause there for a moment. Practicing veterinary scientist who is by her own bio. Coming this way. Can we ask that everyone turn their mics off, please? If you have your mic on, could you turn it off, please? Mute it. Thank you. And so I'm sorry, Dr. Richmond, to finish. Anyway, you are moving on to also greater things. You're going to do work in a preventive veterinary science. Those great things. And one of the things that I think a lot of people do not realize is that veterinary science is actually one of the oldest disciplines within public health. Has been around for a very long time. American Public Health Association, one of its oldest sections is veterinary health sciences, and we've read many on that. So having said that, I will turn it over to Drs. Schwind and Richmond, who will talk to us about their title, which is Interdisciplinary Collaboration for Pandemic Prevention and Response. And they've added a need for a One Health approach. So without further ado, Dr. Schwind, Dr. Richmond, the floor is yours.
Thank you so much, Dr. Telfair. I appreciate this opportunity to speak with everyone again. I say again because I was just thinking towards the end of 2019, we were able to do a talk on grand rounds, which was the need for a One Health approach to solve wicked problems, of which pandemics is one of them. And here we are about a year and a half later in the middle of a pandemic. So it's really interesting to see everything come full circle where we move from preparedness to response. I know the DYADs usually talk about faculty student mentorship, but Dr. Richmond is a student who has a ton of experience already. And so we're going to approach this with just the idea that we're going to talk a little bit about the things that we have in common, the things that we've done in the past prior to COVID-19, as well as the things that we're actively involved in, many of which I see there's a lot of volunteers here who have been helping out with vaccine clinics. And so we think that a lot of people want to hear about kind of the happenings that have really propelled the vaccine clinics here at Georgia Southern. So we're going to kind of take a different approach. Just to give you a little bit about our background and how we came together. My background, I did go to Georgia Tech, where I got a degree in applied biology with a minor in international affairs. So working in global health was always a passion of mine. Moved to New York in order to get my MPH in epidemiology, and there I focused on nosocomial outbreaks, so always loved infectious diseases. There was a particular outbreak in a tertiary care center just north of New York City of Klebsiella pneumoniae, and so we did research there, and then I moved out to University of California, Davis in order to get my PhD at UC Davis in infectious disease epidemiology, where I worked with the One Health Institute. This is, we'll talk a lot about the idea of One Health for those who may not know it, but this particular group was based in the School of Veterinary Medicine. And so I was able to really jumpstart my career working with veterinarians in order to prevent the next pandemic. Holly?
Yep. So I got my bachelor's from Colorado State in 2002. And my focus at that point was actually in equine science, which I don't do at all anymore. But my focus was on horses, and in particular, endocrinology and reproductive research in horses. And then I really shifted into small animal when I started vet school in 2003. And I have been really focused on small animals since then, clinically anyway. So I graduated from there in 2007. While I was at CSU in vet school, I worked in the clinical pathology lab. So, you know, worked with some research projects there. And then I also worked in a feline infectious disease research lab. The diseases I studied were not zoonotic diseases when I worked in that lab, but that lab did work a lot in zoonotic diseases of cats. In particular, we worked with toxoplasmosis, and the leader of that lab was really interested in toxo during the AIDS pandemic. So he really got me interested in the One Health research, starting in vet school, talking to people who were HIV positive or had AIDS about how to be able to live with their cats. Because at the beginning of that pandemic, people had to get rid of their cats, or were told to get rid of their cats. And so he really focused a lot on how you can live safely with your cats and understanding what infectious diseases they carried. So that was kind of the start of my interest in infectious disease, in zoonosis in particular, and then came to Georgia Southern after practicing clinically for about 11 years, because I really wanted to get back to those roots.
And just to kind of talk about how we met up. So Holly enrolled in epidemiology, which was a foundation course for the MPH. And she was taking it online, and I teach the online epidemiology course. And on the very first module, we always have introductions. And when she talked about her you know, background in as a veterinarian, I immediately reached out to her and was like, oh, this is cool. I'm in One Health, and, you know, always looking for collaborations. And Holly was a great student. And in fact, you know, every discussion post that she posted on was on a topic that I personally was interested in. So further down the line, when I had an opening for a graduate student, I reached out to her and was like, hey, you know, here's the One Health research, you know, I'm working on, and I could really use, you know, somebody with a background in animal health, and would you be interested? And much to my joy, she said yes. And so I guess the rest is history. She came on, and we immediately started research, which we'll talk about today. So many of you, if you were in the Grand Rounds talk, you might recognize this slide. This is a slide that's really near and dear to my heart, because it is based on a landmark paper by Jones et al., who basically said, you know, I'm going to look at all of the emerging infectious diseases from 1940 up until the early 2000s, and I'm going to see, you know, what are some of the trends that, you know, we may be able to see out of disease emergence. And one thing they found is that about 2/3 of emerging diseases tend to come from zoonotic sources. So when we say zoonotic sources, it's the movement of animals, diseases from animals to humans, so zoonotic origin. And then about 75% of those tend to come from wildlife. And so if you are interested in infectious diseases, and you're really interested in the idea of prevention, which as public health professionals we all are, it really necessitates that you get into, the field of animal health. If you are, looking at ways to prevent the next pandemic, if you're looking at ways to reduce the impact of outbreaks in communities, then really what you're wanting to do is to go to the source. And in many cases, the source is an animal. And so that has really propelled everything that I do from a research perspective. Not only that, another interesting thing that came from this study is that you can really start to see hot zones, if you will, zones of increased likelihood of transmission from animals to humans. And so these hot spots of disease transmission can occur globally, but there's some areas where this transmission is most likely to occur, especially at that animal-human interface. And so Nepal is a small landlocked country between India and China. If you can see my cursor, this is it right here. And the Himalayas run right on the northern border. And I had some colleagues who I had a history of working with while I was at UC Davis. And so when I needed to focus on one particular country, Nepal was the obvious one if I really wanted to do research in emerging infectious diseases. Holly?
Yeah, I think that, the Jones et al. Paper, that especially this slide, what's really interesting to me, and this is sort of my own personal thing, not maybe more than Jessica, I'm really interested in vector-borne pathogens, and the overlap that you can see between A and D on this slide is one area that I'm really interested in, because we can use animals as sentinels for emerging vector-borne diseases. And you can see the overlap of those maps. And so that's one research area that I'm really interested in that sort of came out of this paper that I think Jessica maybe a little less so.
Yeah, no, typically a lot of the research that I do is in livestock interface, but vectors absolutely play an important role. So, another thing that I had been involved in the past at UC Davis was this idea of pandemic prediction and pandemic prevention. So I say prediction, so I was a part of USAID Emerging Pandemic Threats program, the PREDICT project, as a doctoral student. And this project was really aimed at understanding viral diversity, and in order to predict what viral family will give rise to the next pandemic. And so as a part of the PREDICT project, I was a part of the evaluation team. So I was, interviewing wildlife stakeholders, really understanding zoonotic transmission in communities, understanding education endeavors. But a big part of the PREDICT project was, discovering viruses, and discovering, okay, well, if we know that influenza viruses, can give rise to pandemic, which has happened numerous times in human history. What is it that we don't know yet, and how can we gain that knowledge so that we can kind of see what's coming in the future? Because we know it's not a matter of if, it's a matter of when. And so if we have a better understanding of these viral families, then ultimately we could understand what's coming our way better. And so coronavirus family was one of the ones, obviously, because of SARS and MERS. And so but there were a ton of other viral families that were observed during the PREDICT project. So I kind of view human history as jumping from one pandemic to the next. and I guess that's just what you do when you're an infectious disease epidemiologist. But basically, I want everyone to understand like the pandemic phases and what that looks like. So obviously you have pandemic preparedness, which is really what occurs during the inter-pandemic phase. And then you have alerts that are put out. You have maybe even a public health emergency declared by the World Health Organization once it meets certain criteria. And then of course you have full-blown pandemic. Many of us probably easily remember the 2009 H1N1 pandemic. Influenza has always been kind of on the forefront of all of our minds. But of course, 2020 and 2021 will always be remembered as, COVID-19 pandemic. So right now we definitely are in the response phase. Maybe even getting into the transition phase now that vaccines are available, and vaccination uptake is increasing. But we're very much still in the pandemic phase, that's associated with COVID-19. And so we're going to talk a little bit about, the things that we did before COVID-19, because like many of you, it's like, oh, this is what I did before COVID-19. This is what I'm doing now in COVID-19. And then we'll talk a little bit about the next inter-pandemic phase and what we can do to maybe prolong the onset of the next pandemic that we see. So just for people who are not aware, the One Health approach is a really simple, awesome idea that's really hard to implement in practice. So the One Health approach is just the idea that animal health, human health, and environmental health are all interconnected, and that you cannot have optimal health in one sector without achieving optimal health in all of the others. So if you are, if you have, an unhealthy, environment, then humans and animals will not, see their optimal health, as long as that's happening. Now, putting that idea into practice through increased communication, increased collaboration across these health sectors all sound like a really good idea, but I think, we all know how we can practice in silos and how easy it would be for, say, a medical doctor and a veterinarian to never meet, in practice. So, the idea of One Health, I think everybody is on board with. The idea of the need for One Health, I think not a lot of people would argue, but whether or not they use that as their guiding force for all of the work that they do is a different story. And so Holly and I are constantly coming back to, how can we use our skill set and our knowledge in order to, not just improve the life of humans, but also animals and the environment as well, on an equal playing field and not as something secondary that could be achieved. So a couple of projects that we worked on that we'll talk through quickly is we published on looking at One Health communication in Nepali media. We did a primary data collection and then got that information or that data analyzed and published. We also looked at biosecurity and biosafety for spillover prevention in commercial poultry farms in Nepal. This was a secondary data analysis with some of my in-country partners, which we ended up presenting at APHA this past year, where we looked at practices and knowledge of zoonotic transmission of diseases. Also with the help of another student, Joanna, we published a systematic review looking at climate change and health vulnerability in Nepal. And we also were looking at livestock and emergency preparedness, both on the coast of Georgia and in Nepal. That was going to be primary data collection, but again, COVID-19 happened. So we'll talk a little bit about each project quickly. So one of my, I'm personally like addicted to news. I love news. And with that, when I read the news, I always think, oh, but this is not the whole story. So when we talk about zoonotic diseases, but we're only talking about the humans and how they're impacted, I really feel like we're missing out, on the bigger picture, which is this is how, industrial pollution upstream is affecting humans downstream. Like, why aren't we talking about that? Or this is how increased vector range is impacting humans and animals. This is why livestock's dying, and this is why humans, are losing their source of income. So one thing I wanted to do, because I had a history in looking at the way media globally reports health events, is I wanted to look specifically in Nepal how they reported health events. Nepal is a really interesting case study because they are starting to get we have this idea of freedom of the press. They have developed in the last a couple of decades a new constitution. They're starting to gain freedom of the press. They no longer have a monarchy, and really the kind of freedom of thought is really being exercised. And so I wanted to understand better how these health events or these risk of adverse health events is being reported in the media. And so through that, we were able to, talk to different journalists and see, really where the gaps of reporting were. And so that was really a great opportunity for us to work together. Holly.
Yeah, so this was a project that our in-country partners in Nepal did the primary data collection for. And Ioana really put together a great lecture for APHA last year. And it just related to biosafety and biosecurity on really small and medium-sized poultry farms in Nepal. So the picture on top is a bunch of dead chickens from high-path avian influenza, which is really highly fatal in poultry populations. The picture on the bottom is the migratory flyways of the world. And you can see that Nepal, the East Africa and West Africa flyway, and then also the Central Asian flyway are really important in Nepal and potentially important in carrying a new strain of HPAI to the rest of the world, to Africa and Europe in particular. So that was sort of why this project was undertaken. And it looked at biosafety, which is really preventing unintentional exposure of like workers and accidental release of pathogens from the farms into wildlife. And then biosecurity is really preventing sort of misuse and release of pathogens that is maybe more concerned with intentional or not even intentional, but unknowing issues in the workers at the farms. So they looked at some biological samples, but we focused a lot on a survey that they performed that looked at what the farms were using for disinfecting. Were they getting regular veterinary care? What were they doing to limit the potential of spillover events? A big concern is letting ducks intermingle with poultry is a really big concern for HPAI. And in the US, we're very, very careful to prevent that. And so we just kind of wanted to look at what was happening overseas as well. And obviously I think the answer is there's some knowledge, but that can be improved on to try to prevent those kind of events. This was really Ioana's project as well. So we helped her with it, but she did a lot of the primary work on this review paper. So this was a systematic review looking at how climate change is affecting health in Nepal and overall health, not just infectious diseases. There's a lot of papers that look at infectious diseases, but we wanted to look at health from other angles. We wanted to look at what climate change was doing to psychological health in Nepal. They had a very large earthquake there in 2015. So this was looking at 2010 through that period of the earthquake, looking at how climate change and those kind of events really are affecting the people there.
So one project that both Holly and I were really excited about, and we probably spent 9 months preparing for, was looking, it was a 2-phase study that we were really looking at knowledge, attitude, and practices in order to develop really actionable strategies for livestock owners in the middle of emergencies. It didn't have to be, a set emergency, like it could be a natural disaster like the earthquake, or it could have, it could be a pandemic. But we really wanted to figure out what were some of the livestock practices that were happening in rural villages in Nepal, and how could we take that knowledge and develop strategies in order to help them to adapt to whatever they may be facing. And so we got approval through the Nepal Ministry of Health to do the work. We got approval through Georgia Southern IRB to start the primary data collection, and we had our plane tickets purchased and ready to go. And hit the ground running in Nepal. And we were supposed to take off March 14th of 2020, I think was the day. And I guess everybody knows about that time, everything was starting to go on lockdown, if you will. We saw the writing on the wall. Usually I don't let things like that stop me. I still like to get out to the field and see how I can help. That's what happened with the Nepali earthquake, but I think the writing was on the wall, and we decided to put a pause on this trip. And so this particular research is paused for right now. We hope to pick it up, but we quickly had to pivot because the pandemic was really starting to shape up. And so that was all of our research that we were working on pre-pandemic. And then now in the middle of the pandemic, we'll talk a little bit about how we pivoted and where we're going from there. Holly.
So this was sort of the first paper that we published after the pandemic started. So we really took developed a database of about 65 different variables for that represented social determinants of health, as well as demographic characteristics on an ecological level in all of the 159 counties in Georgia. And then there's obviously a lot of overlap between those variables, a lot of multicollinearity when you try to run a regression analysis. And we were really looking at this point, we were looking at COVID infection rates. We were not really looking at any death rates or hospitalization rates or anything else. You're really just looking primarily at infection rates. And because of that multicollinearity, we ended up using a lasso regression model, and that worked really well. And we did that, ran that model in April, May, June, July, and August of 2020 for all of those counties. And you can see that the R squared, you can see that it actually dropped in, that's May, that's May, June, when some of the prevention practices were really put into place. And then by the end of the study in August, we had a R squared of about 0.45 for those social determinants of health that the computer really picked for us. And that really lined up. So that was kind of a unique approach because we used computer learning to choose the variables, which is just another approach, not a really traditional epidemiologic approach. But the second paper there was a similar paper, but used more traditional epidemiologic approaches and didn't use computer learning. And I think the point is that they lined up. So we were using two different methodologies to show the same thing, that the social determinants of health, guess what, are really, really important in infection rates and outcomes in Georgia. And the interesting thing from the first paper for me was that not only were the social determinants of health important, they increased in importance as the pandemic progressed. So even though we knew that systemic racism was a really big issue in this pandemic, especially in our state, it was getting worse and not better. And that was sad, but I think important information to put out there, that we knew that it was a problem and it was not, we were not getting it. It was not getting better. It was just getting worse.
Yeah, especially so our focus was in Georgia here. And I do want to point out that it was a huge collaborative effort with multiple people here in the Jiann-Ping College of Public Health. So Dr. Rachani helped us out with the analysis and helped guide that modeling. Dr. Fung, who I've also collaborated with other COVID-19 papers, was a great collaborator. Dr. Shah, he was instrumental part, and one of his former students, who is now a professor at Augusta University, it really led the efforts for that second paper, and they kindly invited me and Holly to help participate. And so there was a lot that was happening in Georgia early on, and Holly and I focused on really getting those analyses out early on. So that brings us, I think, to kind of, so we're transitioning from kind of the immediate response to the COVID-19 pandemic to now that it all sets in, that we've got another part of the pandemic phase, which is, now that science has, saved mankind yet again, we now need to figure out how we can get these vaccines out. So one thing, so I'm involved, both me and Holly and several others are involved in the vaccine clinics or the vaccine response here at Georgia Southern. One way that I got involved was I had done some service learning projects with the South Central Health District, which is a district just north of here, near where I live. And I had helped them with their drive-through flu clinics in prior exercises. So this was pre-COVID-19, where we were holding community drive-through clinics in order to serve two purposes. One, we really wanted to increase vaccination uptake of the influenza flu vaccine. And we also wanted to help these communities prepare for an emergency response should it ever come. And so I really loved this whole idea of drive-through clinics. So I was very eager to continue that line of research. We had both student and faculty, Dr. Buck, who is a graduating DRPH student. He led the efforts with a systematic review of drive-through practices. Dr. Cowan was, by my side, and we were working on helping propel this line of research on. With Dr. Buck, when the pandemic started, we were actually going to poll different districts throughout the state about their drive-through practices. And we were going through all those IRB approvals, but then the pandemic started, and it's like, oh, okay, well, they're not in pandemic preparedness anymore. They're actively responding, and so their likelihood of completing this survey that we developed is pretty small. So we had to pivot there. But this was kind of my experience with vaccine clinics. I really thrive, and I think Holly would say the same, in getting out of the classroom and getting into the field and doing the boots on the ground work. Any opportunity that I have to get out in the community is something that I live for. So this was a great opportunity for students to take part in these flu clinics. And little did we know that this opportunity would help guide vaccine clinics here on campus with the pandemic. And I just wanted to briefly mention that there are One Health opportunities wherever you look. So across the United States, people, see the importance of human-animal bond. And so they really develop clinics with this bond in mind. So, if you wanted to get, your dog's annual rabies vaccine, then, that would be one example of how you could take a One Health approach through something like a drive-through clinic. So I just want to quickly, for the sake of time, kind of give a quick background of the history of this. We, as the United States, we needed to quickly develop ways to have mass dissemination of supplies in the case of bioterrorism, in the case of attacks. And so this was really pushed after the anthrax attacks and World Trade Center attacks. And so emergency preparedness really came to the forefront here. And so there were a lot of plans that were developed in order to say, how quickly can we get the much needed supplies to communities. And so a lot of these things, like the drive-through flu clinic, were built on this idea that communities need to prepare in case something like this happens. And so just so everybody understands, when we talk about pods, or when we talk about vaccine clinics, in this particular case, we're talking about mass vaccination clinics. And you have two different types of pods, which just mean points of dispensation or points of dispensing. You can be dispensing medication, like say you needed to dispense antibiotics in the case of an anthrax attack, or say you needed to dispense vaccines in the case of a pandemic. An open pod is one that is open to anybody in the community. A closed pod is one that is open to a specific organization. And so when you see like the Bullitt County Health Department running, their pods, then it's an open pod for anybody in the community to come and take part of. But here at Georgia Southern, because we're our own entity, our own organization, we're developing a closed pod for dispensing. So there's a bunch of different criteria that you would need in order to develop a closed pod. When early in 2020, the health district approached Georgia Southern and said, hey, you might want to think about becoming a closed pod. Then it was there was some internal discussions about, well, what does that look like, and what are the resources that are needed. In the case of a closed pod that dispenses vaccines, you need to make sure you have medical personnel who can help facilitate that, but you also need a ton of other volunteers, especially when you're looking at the number of students, faculty, and staff that Georgia Southern serves on a day-to-day basis. Becoming a closed pod is really beneficial to any organization. Because we are our own kind of entity, because we are an approved vaccine provider, we are able to receive information about the incident or the pandemic, which is really helpful for day-to-day operations. And it's about protecting our own. Like we all want to get back to kind of quote unquote normal, and how can we take care of our people? And so having that closed pod and really making that opportunity available, in terms of ease and flexibility, is really important, and was really important, continues to be important to administration here. And so when they suggested that we develop our closed pod plans, that's when we started to get to work drawing up those plans. We needed to create the plan. We needed to really bring a bunch of people to the table, and we really needed to figure out, well, what is this? It's one thing to draw it up on paper, but what does it look like in reality? And so
I
Oh,
think the
sorry,
other
go ahead.
really thing, sorry, I think the other really important thing about closed pods is that it is about protecting our own, but also we're vaccinating this group of people that now the open pods at the health department don't have to do. And so it's not feasible, or it would be a lot harder for the health departments to vaccinate the whole population without the help of these closed pods that are at, large centers with a lot of people like universities, but also hospitals. Getting those vaccines in the hospital workers early, that was all the work of closed pods too. So I think that it's important that we're working in a partnership, and without the closed pods it would be really hard to deliver as many vaccines, I think, as this area has.
Yeah, it definitely, that's an excellent point. It eases the burden that is placed on the open pods. And so, when we talk about the Georgia Southern community, we're also talking about people who may not have a direct affiliation, but Georgia Southern is a big part of Statesboro as well. So, just quickly, we developed a closed point of dispensing plan for Georgia Southern during a generic public health emergency. That took about 6 to 7 months of back and forth, in terms of development. And about the time we got that plan, developed, then that's when we started getting word about the vaccines that were in development are starting to move into production. And so we immediately had to say, okay, well, here is a broad plan for public health emergencies. How do we now tailor it to the specific COVID-19 pandemic and the very specific characteristics of the COVID-19 vaccine? And that is a whole nother endeavor. Okay. And so looking back, we as a group really achieved a lot, even before the vaccines were approved for use, authorized
Yeah,
for use here in
it
the
was
United
just
States.
hundreds of pages of information.
Yeah. So some of the closed pod process phases, when we talk about things like, deployment and activation, there's a really defined kind of chain, or process chain, if you will, that we go through. In a scenario like a chemical spill, you say, okay, I've got 48 hours to put up a pod in order to help address this situation, and then I'll do it for a week or till whenever the needs are met, and then I'm going to take it down. It's a very well defined. Obviously, COVID-19 is still going on. Pods are still happening, and so this was a little bit different. But we constantly go through this process of, obviously the emergency has already been declared, but the activation of the pod, now we have to set up, now we have to brief, we have to conduct just-in-time training, dispense, and then we have after action, and then we do it all over again. Now, obviously, all of this will fall under the COVID-19 pandemic umbrella, but one thing about this response is that it is very much a marathon and not a sprint.
Yeah, we go through steps 4 to 7 like twice a week.
Yeah. And some weeks are a little bit tougher than others, for sure. So the only way that this can be done is if we bring together people from all across the campus, and with help, from district officials as well. So Dr. Brian Deloach is the medical director of Student Health Services. He is considered, the closed pod coordinator. And we also have several coordinators from other departments as well. So we have security coordinator who's from the Office of Public Safety. We have facilities, marketing and communications play a very important role. School of Nursing provides dispensing staff. Obviously, College of Public Health is super, super important in terms of logistics. Office of Legal Affairs is involved, information technology, parking and transportation, athletics, and of course, our partners with the health district. It takes a lot of people in order to put on something like this. And any like if you were to remove any group from this bullet point, it would fail, because everybody plays such an important role. Just to kind of help bring this home, closed pods follow typically an incident command structure, which is, you have your command team, where you have your coordinators who really lead, the team leads and the volunteers in their specific chain of command. So you see the closed pod coordinator is Dr. Deloach from Student Health Services, but we have communications coordinator, Dr. Lester, Maura Copeland's in legal affairs, emergency management coordinator is Lieutenant Eric Reiner from the Office of Public Safety. Ron Stallnacker is the IT coordinator. Chief McCullough is the security coordinator. Dean Tedders is the logistics coordinator. Dr. Gilbert from nursing is the dispensing operations coordinator, and Katie Twining is the facility coordinator. And all of these coordinators meet multiple times. And when I say multiple times, I say at least 2 to 3 times a week. It could be meeting at the pod, it could be having a command team meeting, but they come together in order to make these things happen. And so seeing this kind of interdisciplinary approach is something that me and Holly, we love because of One Health, but seeing it in action in pandemic response is just further proof that getting people to the table and with their expertise and with their knowledge is the only way to see the success in something like this. And so you can see different teams, and we have team leads under each of these coordinators who help facilitate that volunteer process as well. So quickly, the plans that you put on paper may not always turn out the way that you think. These were our initial traffic flow plans. This is when we thought that maybe we would be administering vaccines, no longer than like a month. We could get everybody vaccinated in a month and it'd be good, so we were really seeing, okay, well, what's the max traffic flow that we could achieve in a short period of time? We see that that's not really what's happening now. And so of course these traffic flow patterns change. And, even if you go in with, the best laid plan, reality sets in quickly. And so you have to make some pretty quick changes. And so this was the ideal scenario. But each week we make the changes that are needed. So I am very thankful, grateful to say that we were able to actually implement these plans. And so that was really awesome to see, everything that you just spend months and months working for, to just, there's nothing better than seeing it in action. And so we have successfully implemented drive-through pods several times now, both at the Armstrong campus and the Statesboro campus. And we've got thousands of people vaccinated. And I have met so many wonderful people through this process. It's really shown me and Holly that, like, when you put your mind to something, you can actually see it through, and it's a really beautiful thing. There's a lot of things that happen though beyond, behind the scenes, I guess. So we do have, these pods are, stood up, activated, implemented, if you will, for maybe 4 or 5 hours, for each day that it's implemented. But there's a lot that happens behind the scenes. And so these are just kind of some behind the scenes shots. We have just in time training that a lot of things go into making that happen, as well as setting up the supplies. Holly, you want to talk a little bit about that?
Sure. Yeah. The picture on the top right is the command center for Paulson Stadium in Bishop. And you can just see like the boxes and boxes of stuff. We have so much stuff that has to be organized and set out for each pod. And then everything has to be organized for the volunteers we track. All of the volunteers for each pod and how many hours they worked, to try to understand, you know, how much work is really being put into this by our faculty, students, and staff. So we have many, many spreadsheets that track who's volunteering, the hours that they volunteered. And then, you know, how many people are we going to have volunteering? Well, how many, you know, job action sheets do we need for that? What is this pod going to look like? How do the job action sheets need to change for this pod versus the one before? So, especially for the first 4 or 5, those job action sheets were being updated every time we rolled out a new pod. And then it's just the little things like we have to make the stickers that go on the vaccine cards, and we have to make all the labels, and so there's a lot of organization, and that's where the School of Public Health has just really shined in the organization factors that were needed for this. I think that the skills of the faculty, staff, and students of our college were really needed and utilized in this, because there's just so much logistical stuff that has gone into making it happen, and you know, making it so that the nursing students and faculty can kind of show up and at the last minute, and they can run out and they have everything they need and they get vaccines and they leave. Because without them, we couldn't do it. And so we need to make it as easy as possible for them, so that we continue to have them show up every week and do this. And if we make it difficult for them, they're not going to volunteer anymore. So that's really been our role, is hopefully making it as painless as possible for the people who are putting in the work and volunteering for the hours that they're there.
Yeah, and I think a classic example are these cutlery trays you see here. Yeah, where, you know, me and Holly, we love evidence-based practices. Like if there's a paper that shows it works, we're trying to implement it. But there's some things that evidence just doesn't tell you, you know. And so when we're having to count the number of syringes pulled from a vial, so Moderna, which is the vaccine we give here, has 10 to 11 doses per vial, and we need to keep up with the counts. We realize that the best way to track these things is through these cutlery trays. So I, you know, took off to Walmart one day and started buying cutlery trays in multiple Walmarts in order to get to that point. So anyways, you know, there's a lot of ingenuity that's happening through this process. And a lot of it comes from volunteer feedback. So somebody is on the ground saying, hey, you know, what would be better is if we did this. And I read those results and we try to implement that. And it's really come a very long way. So you know, I had a quick video of outdoor pods, but for the sake of just moving forward, I'm gonna I'll show that towards the end. We did end up moving indoors for a variety of reasons, since population prevalence of COVID-19 is decreasing, since temperatures in South Georgia are increasing, and we really need to have tight temperature control for the vaccines. We ended up moving indoors, and that was awesome for Gus, because I'm sure he gets really hot in that costume as well. But just like indoors, we have to implement a flow plan and make sure that we address the number of people who are moving through an area. So just to piggyback off of what Holly was saying, like we could not do this without the volunteers. We can, you know, a small pod may have about 30 volunteers. A large pod, which we'll be having on Friday, will have at least 100. So we absolutely could not do it without our volunteers and everybody who has made this possible. And let me tell you, after such a tough year of 2020, some of the happiest people are the volunteers out there making a difference in their community. It's just so great to get behind an idea of these vaccine clinics and to just share that joy with other people. So we're just so thankful for the volunteers. And we just want to say that, you know, this was an article that Dr. Hansen forwarded to the team. The headline said, veterinarians, teachers, students are stepping up in order to help the vaccinator workforce. That is exactly, you know, I echo what Dr. Hansen said. That is exactly what's happening here. It's a true example of One Health in action. And it really shows you that if you bring people to the table, if they have a buy-in, and you're not just, one thing I want to stress about the command team is everybody's not coming together and then going back to their office to work, right? We're doing the work on these calls. We're doing the work at the pod together, because if any one part of the pod fails, then the whole pod fails. And so, that's really what separates interdisciplinary collaboration from multidisciplinary collaboration. So, we're all coming to the table, we're all contributing something. And I hope that the Georgia Southern community has seen, and I think based on survey data, that everybody is really super appreciative of everything that goes into making something like this happen. Holly, I'll let you have the final word.
yeah. So sorry, we're running out of time, but just briefly talking about the how do we prevent the next pandemic, and what do we learn from what happened during COVID, and how can we improve for the next time, because it's going to happen again. We can't prevent spillover events. That's great. It'd be nice. We can maybe decrease their frequency if we do a really, really good job, but you would have to change how the entire world behaves to prevent spillover events. It's never going to happen. But if we improve surveillance systems, then we can find those spillover events sooner and do more to understand and prevent them. So, identifying gaps and going into those areas and improving surveillance is a really big part of what One Health does. This paper, just briefly, is a paper on Ebola, but I think that's what really is important about this paper is that they looked at the reservoirs for Ebola. They looked at bats, and then they looked at climate change, and they looked at flights where people in Africa were flying to and from, and they said, hey, the potential for Ebola outbreaks is actually quite a bit larger than what people previously thought, and there's quite a few countries in Central and Eastern Africa that are at really big risk, even though they haven't had outbreaks yet. And so focusing on those areas, so that's just an example of what we need to be doing.
Yeah, and I'll just say, if we focus on animal health and promoting animal health, then we won't need to have pod plans into place, because emerging infectious diseases will be decreasing. And so really focusing on preventing pandemics from their source is really something that we hope that we can get better at as the future progresses. So we're happy to take questions. We're happy to stick around. I know some of you probably have to go. We would be thrilled to answer pod questions. We would be thrilled to answer One Health questions. And I can also show the pod drone footage as well if people are interested. So thank you.
Right. So thank you, Doctors Schwind and Richmond. So we unfortunately are totally out of time. However, what I would say that if anybody wants to stay on and talk to Doctors Schwind and Richmond, we will leave the feed up. And if you have to leave, but I'm sure that they will follow up. And then now we'll turn it over to Dr. Schwind and Richmond and let you all close out. But let me just say thank you both for a phenomenal presentation. We were, sorry that we could not provide you with more time. That would have been fantastic.
We love talking about this stuff.
No, really? I'm kidding. So we appreciate it tremendously. And then Dr. Schwind, we appreciate you willing to come back and talk to us again. And it's like a bookend on your work, but you're right. This is phenomenal. You were just talking about this to us in Grand Round. So we hope to bring you back. And Dr. Richmond, we wish you all the best, in your next steps, as well as you, Dr. Schwind, in the next steps. So anyway, having said that, we'll officially close, but we will leave it up for the two of y'all, and we'll go from there. So thank you, everything. We want to thank our audience and everyone for attending our last seminar of the semester. And we hope that you all have found this to be a great experience through all our seminars, and we look forward to resuming them in the fall. So we appreciate, as always, ideas from y'all. as to what we can present, and then we'll follow up. So thank you both again. Tremendous work, and we will leave it up. So thank you both. So we officially will close. I will go, but we'll leave it up to y'all to speak to anybody else who wants to stay on and talk to you. Okay. All right. Thank you both. And we'll leave it to you. All right. Bye-bye.